Hip dysplasia surgery and recovery in Brittany dogs. Brittany dog hip dysplasia surgery and recovery. Hip dysplasia is a common orthopedic condition that affects many dog breeds, including the Brittany. It is a genetic disorder where the hip joints fail to develop properly, causing discomfort and mobility issues for the affected dogs. In severe cases, surgery may be necessary to alleviate the pain and improve the quality of life for these dogs. In this article, we will discuss the process of hip dysplasia surgery in Brittany dogs and the recovery period that follows. Hip dysplasia surgery is usually recommended when other conservative treatment options, such as physical therapy and medication, fail to improve the dog's condition. The surgical procedure involves joint reconstruction to correct the abnormalities in the hip joint. There are different surgical techniques that can be used, including total hip replacement or femoral head ostectomy. Total hip replacement is a more invasive procedure where the damaged hip joint is replaced with a prosthetic implant. This option is usually considered for younger dogs that have good overall health and longevity. On the other hand, femoral head ostectomy involves removing the ball-shaped head of the femur bone, which then allows the surrounding muscles to support the joint. This procedure is often recommended for older dogs or those with other health conditions that make total hip replacement riskier. Before the surgery, the dog will undergo a series of tests, including X-rays and blood work, to assess their overall health and confirm the diagnosis of hip dysplasia. Once the surgery is scheduled, the dog will be placed under general anesthesia to ensure a painless and stress-free experience. The surgical team will carefully make an incision near the hip joint to gain access to the affected area. During the surgery, the surgeon will either replace the damaged hip joint with a prosthetic implant or remove the femoral head. The choice of procedure depends on the severity of the dysplasia, the dog's age, and overall health. After the surgery is complete, the incision will be sutured, and the dog will be closely monitored during the recovery period. The recovery period after hip dysplasia surgery is crucial for the dog's successful outcome. Pain management is a priority during this time, and the veterinarian will prescribe pain medication to keep the dog comfortable. Additionally, the dog's activity will be restricted to prevent any complications and allow the incision site to heal properly. This means no excessive running, jumping, or strenuous physical activity for a few weeks. Physical therapy and rehabilitation are vital aspects of the recovery process. The veterinarian or a specialized physiotherapist will guide the dog's owner on exercises and activities that will help strengthen the surrounding muscles and improve joint mobility. These may include passive range of motion exercises, hydrotherapy, and controlled leash walks. The duration and intensity of the physical therapy program will depend on the dog's progress and the surgeon's recommendations. It is important to note that every dog will have a different recovery timeline, and some may take longer to fully heal than others. The dog's age, overall health, and the severity of the hip dysplasia will have an impact on the recovery process. It is essential for the owner to closely follow the veterinarian's instructions regarding medication administration, activity restrictions, and physical therapy sessions. During the recovery period, it is common for some dogs to experience temporary setbacks or complications. These may include infection at the surgical site, inflammation, or muscle weakness. It is crucial for owners to monitor their dogs closely and report any unusual symptoms or behaviors to the veterinarian promptly. Early detection and appropriate treatment of complications will contribute to a smoother recovery and better long-term outcome for the dog. In conclusion, hip dysplasia surgery can significantly improve the quality of life for Brittany dogs affected by this condition. With advances in surgical techniques and post-operative care, many dogs can regain mobility and lead a pain-free life. However, it is important to remember that surgery is not a cure for hip dysplasia. It is a management option that aims to reduce pain and improve function. With proper care, including pain management, restricted activity, and physical therapy, dogs can have a successful recovery and enjoy an active lifestyle.